Compartment syndrome is a limb-threatening condition where the blood supply to the muscle compartment is limited by the muscle swelling too much and not having any space to go, which eventually causes the blood supply to be impeded and the muscle to die. This is a process that within 4 to 6 hours will cause permanent muscle death, pain, and function disability loss. And so treatment needs to be initiated as soon as diagnosis is possible. The most common cause is high energy fractures. Generally in younger people, this is more common because they have a firmer fascia and they have more muscle mass. So car accidents, motorcycle accidents, skiing accidents, falls from height, these are the most common things. On top of that, crush injuries are really common. So industrial accidents where people have been crushed, burns, because we see a lot of burn patients here. Burns increase your risk of compartment syndrome because the skin and fascia becomes less pliant and can't expand. Treatment of compartment syndrome is relatively straightforward. You just release the pressure in the compartment. The problem is diagnosis. So it's a true surgical emergency. Once you have decided a patient has compartment syndrome, they should be in the OR ASAP stat, having the compartments released. So yeah, sadly, if you have a missed compartment syndrome, if it's a couple of compartments, then there's tendon transfers and things that can be done. If it's an entire limb, like tibia down, forearm down, sadly, there's very little that can be done at that point. The repercussions of a missed compartment syndrome are truly catastrophic. What happens is the muscle just necroses and dies. And as long as it's not open, it doesn't get infected, it just becomes necrotic and woody. But you effectively get left with a chronically painful, contracted, useless limb. And then often patients end up getting amputations because you have a limb that just hurts all the time, you can't use it, and it's really devastating. So that's why diagnosis is so important.